Hey guys, welcome. It's good to have you here, Dr. Greeny. I got a special guest going to join me here in a moment. It's been a little bit since we've done a skincare Q&A, so happy to have you guys here and looking forward to taking all your questions. Congrats to the winners of the skincare giveaway. I am going to have that stuff sent out probably tomorrow, so just let you guys know. There was one person on YouTube that didn't get back to me, so if you entered the giveaway and didn't get back to me, make sure to check out the YouTube because I need to hear from you and get your address so I can send that stuff out to you. All right, and we're live, of course, on YouTube and Instagram, so feel free to hop on over there if you prefer. Looking forward to just taking your skincare questions today. So I'm going to see if we can get the guests in here. Here we go. Let's send him a request to get on here. Hey there, what's up, Mel? What's up, Annika? Good to have you. How to avoid pimples. So that's a good question, a common question I get, how to avoid pimples. So pimples are definitely a frustrating thing, and you gotta start doing something regularly. So some of the best things you can do is use a good cleanser every single day, like benzoyl peroxide in the morning. And then you want to be using some type of retinoid at bedtime, and that's going to actually help prevent new pimples from forming. So you can do that. It's going to take you about 6 weeks to start noticing a good improvement. And I got a question here from Shabazz asking about, does Inculus tranexamic acid reduce hyperpigmentation? So it certainly can. That's one of the best treatments for it. Let's see. All right, we'll see if we can get our guest on here. You guys are going to be excited. Someone you don't know, but it's someone you don't know, but certainly an expert in a particular area of dermatology. So we'll see here. So does double cleansing harm the skin? So there are some studies that look at double cleansing and some that actually say it kind of worsens acne. But for somebody that uses a lot of makeup or uses waterproof sunscreens, that would be something you could definitely consider. Let's see, recommendation on color change on the face. Well, a lot of hyperpigmentation deals with sun exposure, so one of the things you're definitely going to want to be doing is one of the best things you're going to want to definitely be doing is making sure that you are using a great sunscreen every single day. And then there's a lot of and here he is. Okay, so this is our special guest that I was talking about. This is one of my fellow colleagues. This is Dan Grove, and I'll kind of let him introduce himself and kind of go on. But so now you have basically two dermatologists to ask questions to. So really, thanks for joining, Dan. Oh, Dan, I think your sound is you're no sound right now. And if you have to go headphone-less, you could try that too. I don't know if it's the headphones doing it. So we'll get it sorted out here. So, yeah, it's still not right now. Yeah. You may have to, I don't know if you may have to hop out of Instagram. I don't know if you give access to your microphone or something, maybe. Yeah. So you can always rejoin if you need to. Let's see. So, yeah. So we're gonna have two dermatologists on here. So little hint at what's going on here. So clear acne, again, benzoyl peroxide cleanser in the morning or a salicylic acid cleanser. Like this is a good example here. This is like the Inculus salicylic acid, or you could go ahead and use a retinoid at bedtime. How to clear nose pores? Another good question. Is beta hydroxy acids like sal acid or other just like general beta hydroxy acids like that Inculus makes, you can try those out. So, and I like using a silicone cleansing brush as well. I think that's a really good way to do it. So I use that maybe once a week. And then your retinoids are going to help prevent the blockage of those pores. It basically makes those sebaceous filaments a little less sticky and allows them to go away, which are like the little like blackheads sometimes people see on the nose. Let's see here. Let's see. Okay. See if we can get Dan back in here real quick. So, how does the efficacy of Taltz hold up once the injections move to once per month versus biweekly? So, Vicky, great question. Taltz definitely has a bit of a loading period where you're doing these more frequently. It is an amazing medicine. It's probably one of my favorites. Let's see. Let's see. Try to get Dan back in here. Let me see if I can text him real quick. All right, sorry for the pause there. Trying to get Dan back in here, so just working on that. Let's see. How to clear nose pores. Can you list some products for teenagers? Yeah, so some of my favorite things for teens is starting with that benzoyl peroxide cleanser. Something like the CeraVe 4% benzoyl peroxide cleanser is a nice option. I like that. There's the La Roche-Posay adapalene. You know, this used to be a prescription and now it's available over the counter, so that's a really nice option for teens. Usually with teens, if you just want to start with a good face wash that has an active in it, that might be the easiest first place to start. But as things get a little bit more involved, then you may want to look into starting some of those retinoids and things like that. And just remember, it's always a good idea to get on top of these problems before they become scarring. So definitely want to do that. Whitehead in the nose and cheek area. So that's another great question, a common thing. Sometimes they can be deeper, and these are called milia. And milia, and of course you can ask questions. So milia are a little bit deeper, and they're kind of hard to get rid of with just medications. So sometimes you guys see your dermatologist, and we can actually extract those, but then you want to use retinoids to kind of help prevent them. So yeah, and this is a Q&A session, so definitely you can ask questions. Let's see. So seborrheic dermatitis maintenance. So that's a good question too. So seborrheic dermatitis is kind of like an irritation from a yeast that tends to grow on all of our skin. And it's like a hypersensitivity. So I mean, your skin's having more of a reaction than it probably should to it. And for that, and a good idea is using a Nizoral or ketoconazole shampoo as a face wash. And you can use it only maybe a few times a week is enough for you. It can be a little bit drying, but that's a good option for maintenance, and there's a lot of good prescription options that have similar but a little bit stronger ingredients. So let's see. Hey there, Dan. Still, let me just see if it's my mic. Is there a mic button on your screen or anything? I have. It's really weird that it's not working. Because I can mute myself, but I can't, I don't see any button to like enable your mic or anything. Did you have the AirPods put up now? Yeah. I don't know what's going on. Yeah. If you take a video, like if you record a video of yourself in the oh, you can hear him? Oh, my bad. Okay, guys. Wow. All right. So the problem is I have my freaking mic plugged into my headphone jack. Oh my gosh. So Dan, of course, man. Of course, I'm the one messing it up. So I'm going to probably switch my mic so I can actually hear you. Thank you, guys. All right. Try that, Dan. Perfect. Oh, yeah, dude. Okay. Anyway. Wow. Well, thank you guys. I appreciate it. They solved the mystery. So anyway, so Dan. So this is my colleague, Dan. He's joining us today. And you can feel free to introduce yourself, man.
Sure. Happy to spend my Sunday with y'all. Thanks, Dr. Green, for inviting me. I'm a board-certified dermatologist. I practice here in Indiana. I'm specialty focused in pediatric dermatology. I'm also trained in pediatric dermatology. So treat a lot of the basic stuff you guys have questions about, whether it be acne or hyperpigmentation. Seems like you guys have a lot of interest in that. But beyond that,
Yeah, absolutely, man. So we've been talking a little bit already about acne. We talked about acne. We talked a little bit about hyperpigmentation. So that's kind of been the gist of it so far. But good questions rolling in, and yeah, Dan is just Dr. Grove is just starting his Instagram account here. So if you guys do want to give him a follow, feel free. I think he plans to share some good pediatric dermatology knowledge with you guys. So and thank you guys all for sorting out the technical difficulties. So VJ, what's up? So Annika asked, what does upping tretinoin concentration do? Does it improve the efficacy? So the most important thing with tretinoin really is is uh, is that you're using it consistently. So it's not really as much about the using the strongest concentration you can, but rather just making sure that you're using it consistently. So if you can only use the 0.025, but you can use it almost every day, then that's great. You know, just stick with it. If you're using a 0.05 and you're not getting irritated at all, then you can consider bumping up for sure. But I think, you know, I don't know about Dr. Grove, but I usually prescribe the 0.025 the most to people. I feel like they tolerate it better. So what do you think about it?
Yeah, I agree. I always tell patients the best thing is the medicine you're going to use. So if you have really sensitive skin and you're going to be irritated, you're always safer to start on the lower strength. And then we have some tricks up our sleeve, whether that be use it every other day or every 2 days or increasing moisturizer is all great. I think the most important thing is people stop it too early. So if you are having side effects, just reach out to your dermatologist or doctor because we always have tricks. And we don't want you to stop it because we need you to continue it for a solid 2 to 3 months to really see that improvement that you guys want for your skin and that we want for you.
Yeah, no, I totally agree. It's so sad when people come back and they think, you know, a lot of people that I talk to, it seems like they come in and they think they had an allergy. They think they had an allergy to the medicine, and you just have to know that there's some degree of dryness and irritation does happen with these acne medicines, almost all of them. And your skin tends to get used to it. And like Dr. Grove said, there's a lot of things you can do to help kind of get through that initial period of 2 to 3 weeks when your skin's a little bit more dry and irritated.
And I do tell patients as you go higher up on the strength, you'll see more improvement. The role of that medicine is almost like a cosmetic peel. We want you to get a little peely. We want you to get a little bit red because that's how we're unclogging your pores. And that's how we're making your skin look healthier.
Okay, yeah. And then Monique on YouTube is actually asking the question about cream versus gel for your retin-As. And I think most of the people that we practice with tend to prescribe the cream for this same reason we're talking about rather than the gel. But maybe we could talk a little bit about who would maybe a gel would be appropriate for.
Yeah, for sure. And then just quickly, Annika, yeah, so Annika, the higher strength, you'll get better results. So that's mainly the difference when you pump up for a 0.25 to 0.5. You might get a little bit more red and irritated, but you'll see better results with the higher strengths. Regarding the gel versus the cream, so when we talk about a lot of topical medicines for dermatology, all that means is the vehicle. So the medicine's the same, but they're packaging it in a different vehicle, whether it be gel, cream, or ointment. A lot of the gels, when it comes to tretinoin products, are actually really great. They go on the skin, they feel great, they're smooth, and you actually get less irritation with it. The only unfortunate thing we find in dermatology is a lot of insurances sometimes don't cover those fancy microgels.
Yeah, that's
Um,
true.
but if we can get that microgel covered, I love that for my patients.
Yeah.
They'll still be smooth, they have less side effects, and it works just as well.
Right. Yeah. And then we've seen, you know, there's been one recently new approved retinoid that came out, but we've also seen some people branching into other vehicles like lotions, and those are very well tolerated, and that's a nice thing. But yeah, the person that comes in, Monique, with really oily skin and severe acne, and you think they can tolerate it, the problem is gels, you know, have a alcohol component to them too, so they're a little bit more drying. But for the person that's real oily, that might be a nice touch actually. So let's see here what we got. So any advice for rosacea? So yeah, so Jay, rosacea is probably one of the most common things that we see, and the like many skin conditions, like the general first steps is making sure that you're doing everything gentle. So you're really going to want to be careful with the number of actives that you're using, and you're going to want to make sure that you're basically avoiding things that are going to irritate your skin more than anything. Finding triggers for your rosacea. A lot of people find that, you know, whether it's UV exposure and sunlight, can affect things, spicy foods, hot drinks, these kind of things, because there is a kind of both a neurologic and like a vascular issue for rosacea. And that's why people feel hot and flushed and things. So knowing those triggers can make a big difference. But if you're not using a great sunscreen every single day, that's probably one of your best first steps. And I think, we find that a lot of people think they get irritated by sunscreen. A lot of times they're using a mineral sunscreen or a chemical sunscreen. So I tell those people probably use a mineral sunscreen and see how you do with that. I think that's a good first place to start. But maybe Dr. Grove can talk a little bit about some of the prescription things that we do and some of the treatments we do for rosacea.
Yeah, so rosacea is a common thing we see, not too often on the pediatric side, but our adult side we see a fair bit. And rosacea can be frustrating. It's frustrating for us doctors, and it's frustrating for the patients, obviously. I think the big thing with rosacea is it's kind of an ongoing chronic diagnosis. There are some things that we do for acne that overlap, whether that be
Right, definitely. Yeah. It's crazy because some of these rosacea treatments can be so expensive and they don't get rated very well, like the ones that particularly help the redness. And it's very temporary, they're very expensive. And for people that where they have redness concerns with rosacea, I usually try to push them towards getting laser therapy done because it's going to give you a bit of a more permanent result as opposed to spending $500 on a cream that's going to work for a few hours. And you can see why the reviews online for those creams are so bad. Yeah, definitely. So, yeah, go ahead. Hmm. Hmm. Yeah, no, absolutely. No, I totally agree. I think that, seeing your dermatologist and getting prescription therapy, if you're able to, is great. And they don't, doesn't always mean it's going to be expensive. I mean, with some of the coupons and stuff, you can get it cash pay for fairly affordable. And these tubes last for 3 or 4 months, I mean, or longer because you're using a tiny amount of it every day. So it's good to have a dermatologist available for you, established with one, because it is kind of hard to get in. So it's better to have one kind of there for you. And who knows, if you get into something where you actually need medical help and you need a way to get in quick, I think it's a good idea. So I'm glad that some of the old prescription options like adapalene now are over the counter, so it is a little bit more accessible. But I agree. I mean, there's no substitute for the prescription options. So let's see. I got some questions about. Let me just scroll down to the bottom here. How to make lips pink and glow. So that's a pretty tough one. There's a lot of lip plumping agents, and this used to be something that was. And I'm getting a little feedback for myself. Do you hear that, Dan? Do you hear like a crunchy? Okay, okay, it's just me. Hopefully. So lips pink and glow. So this is a pretty tough one. For one thing, a lot of people do neglect, um, you know, putting sunscreen on their lips. So they make a lot of really great sunscreen balms. I'm pretty sure Vanicream makes one, LTMD makes one. So this is something you want to be doing. You want to be protecting your lips. Another thing is people do notice darkening of the lips. If you're using irritating products around the lips and around the mouth, or some cosmetic products do contain things that are going to make you a little bit more photosensitive, and maybe it's products that you use around your mouth. So you want to probably keep your skincare regimen gentle around there. Make sure you're protecting it. And then another thing to consider is if you're a smoker, you probably want to stop smoking because that can definitely stain and darken the area around the mouth. So be careful about that. Okay. All right. So yeah, so it's thanks so much. So it is actually that did help it. So thanks so much for that. So what rainbow is this? It looks like my boyfriend's HyperX Quadcast. He's a gamer, also in med school. So that's awesome for one. Congrats on getting into med school, and it's awesome that he's keeping up his hobbies and gaming along with that. So this is a HyperX Quadcast. You nailed it. So let's see, cure for black spots. So happy to take this one a little bit. So you got to be careful for one because hyperpigmented spots or black spots is one of the things we worry about. That's one of the things that can be melanoma. It can be skin cancer. It's one of the type of skin cancers that can kill you, right? Now, it doesn't mean that every black spot is bad. It could just be simple hyperpigmentation like melasma, or it could be a sunspot basically. So some of the things that can help that over the counter are things like azelaic acid. Now you can get tranexamic acid from many companies like SkinCeuticals or InkyList. Those are nice options. There's a great combination cream called Faded by a company called Topicals. So you got to do some, you don't have to use all of those things, but you use one, at least use one or maybe two of those things. And then you have to be using a great sunscreen every single day because if you don't, you're just simply not going to get it better. It only takes about one time being in the sun and getting too much. Like you go to the pool, for example, you lay out for 4 hours, you're back at square one pretty much. I mean, it just takes literally one time. So you got to wear your sunscreen every single day. And I don't know if Dr. Grove has some more thoughts on that.
Like kojic acid or hydroquinone. Those can be helpful, but again, everything works slowly. So don't get discouraged about how slowly it takes to improve. If you stick with it, it will work.
Right, exactly. It's definitely something that is probably, I think you would agree, one of the hardest things we treat. It can be very frustrating for patients and the physicians because it's like you want to get people better and it's a tough thing to treat. I've personally been dealing with a little hyperpigmentation myself recently. As you guys know from the YouTube video, I had Fraxel done, which is a laser procedure, which is pretty irritating to the skin, but that's the purpose. It basically causes thermal damage to the skin to allow new healthy collagen to form. And after that, I had a vacation, so I got a lot of sun exposure, and I developed some hyperpigmentation not only on the middle part of my face, but kind of under both my eyes. So I've been slowly rehabbing that. Um, yeah, so it's tough. So thanks so much, guys, for the information about the mic. I think we got that sorted now. And for the people on YouTube that couldn't hear Dr. Grove, I got my AirPods out now, so you can hear it through my mic again. So thanks so much. Um, so Beauty Buzzing asked about what do I think about retinaldehyde. So retinaldehyde, kind of interesting. It's like a step closer to active retinoic acid. And it also has been shown in studies to have a little bit of antimicrobial effects. So while I don't usually tell people that a retinol will actually help acne because it's really not strong enough, I don't think to give a good acne help, you really need to be using a retinoid. Retinaldehyde, because it does have a little antimicrobial effect, maybe it helps a little bit better. Probably still not as good as, using a real retinoid at bedtime. So the Beauty Buzzing worries about absorption. So really, most of the retinoids are, they're absorbed a little bit, but most of them we really don't worry about until you get into the really strong retinoid classes like tazarotene or Tazorac. So it's not something that I personally worry about, although I'm not going to tell, someone who's trying to get pregnant or someone who's pregnant to use a retinoid. And that's just out of being safe, basically. So that's, a good question. Let's see. So this is a good one, and I don't know if you have any thoughts on it, Dr. Grover. I'll still tell my thoughts, but SJ Jr. So it says, does woman's skin glow differently during different times of the month, like when she's ovulating? Does she look especially glowy and fertile? LOL. Serious question.
Yeah.
It's an interesting one.
No, it's an interesting one, right? So our skin is sensitive, as you all know, depending on like if you get
Yeah, I got you. And I mean, the only thing when the question was asked, um, I thought a little bit about estrogen, and how that does play a role in some like vascular lesions that we see, like when someone's taking oral contraceptives or someone does get pregnant and that kind of thing. It definitely has an effect somehow, right, on vasodilation and vascular lesions. So there is that. But it's a really good question. It's an interesting one for sure. And you actually see there's been some people kind of toying with estrogens in anti-aging products and things, and that definitely is an important thing for that reason too. So
Yeah, part of that too is your hormones are going to dictate your oil production, and we know a good amount of oil, although it leads to acne, also preserves your skin, so you're less likely to get wrinkles, and your skin is more going to be more plump and more healthy. So I'm not surprised at certain times when the hormones are maybe a little bit higher in the bloodstream and the serum levels are higher, your skin's going to glow a little bit more.
right, yep. So, what's the best laser to tighten the face? So, it's a good question. Lasers are complicated, and honestly, the best way to get the best answer for you is to see a dermatologist in person for that, because they're going to be able to look at your skin tone and find out what lasers are appropriate. I will say for people that have light skin tones and there's not a high risk of hyperpigmentation, fully ablative lasers are going to give you the best results, but they're also going to be the most intense to go through. They're going to have a serious recovery time. They're going to be prone to a little bit more complications. But on top of lasers, there's other treatments now that people are using, like the Renuvian device, which is a plasma-based device, and where little incisions are basically made, and basically a plasma rod is put under the skin and applies heat to those areas, and that can actually tighten and contract a little bit. I've seen people use it on the neck, on the face. You definitely want to see an expert, with that, but that's another thing you can do. But basically, ablative lasers tend to be the most effective for those kind of things, and they're gonna cause improvement across the board, kind of. Where if you're wanting to have a little bit less of an intense time, you could use fractionated lasers and things like that, where you're going to heal faster. You're probably going to have less incidence of side effects, although you still of course can have them. And it's going to give you results over a series of treatments, maybe 3 or 4 treatments at a time, and that's going to do good. And then some people will go on and do some maintenance treatments beyond that. Let's see. So my mom has a pimple on her chin since 10 years. How to get rid of it? So this is from Sharji. So yeah. So is it a pimple, Dr. Grove?
Yeah, so it's a lot of times deep cysts on the face can mimic pimples, or you think it's a pimple. So most likely now it's probably some form of cyst. So I do recommend seeing a dermatologist and confirming if it is a certain type of cyst, and then to talk over how to get it removed or talk about the best therapies for sure. Usually acne cysts wouldn't last that long, so it's probably something else.
Mm-hmm. Yeah, I agree. Most likely something else, and it's always trouble because the quick fix of deflating it, and doing an incision or drainage, or basically where you poke and drain it. But it's not uncommon that you do that, and literally 1 to 2 weeks later, it's back again. It's full, and that doesn't solve the problem long term. So that's the only downside about it. It's always challenging when you have a woman like that. They have a midline face lesion, because it's super cosmetically sensitive. And no matter what, if we go to cut that out and cure it permanently, we're going to leave a bit of a scar there. But that's also where, if you have access to a cosmetic dermatologist, you can go through and you can treat that and remove the redness from the scar. You can help smooth the scar out and blend it in with your other skin. But usually, scars are permanent. We can only improve the way they look, but worth seeing a dermatologist about. Or if it's getting irritated, you can potentially do things like injections and things like that, just to calm it down and shrink it down a little bit, which is pretty non-invasive and easy. So actually, I don't know if I've heard of this Sebacia. It's a new treatment. It was FDA approved recently. It uses nanoparticles of gold, and so they say golden laser to clear acne. So, and supposedly clear acne long term. Any experience with it? So I certainly don't have any experience with it, and I haven't been working in an area where they have that. So you're asking about golden laser. So it sounds like this is not. This is probably an FDA cleared device, I think is what you're saying. Sebacia And I don't know about it. I don't know if Dr. Grove's ever heard of that yet. That's a new one for me.
Yeah, I don't, unfortunately. Sorry, I can't help you there. That must be a new one. There's a lot of new lasers and companies coming out all the time. I'm not familiar with that one. We'll have to look into it and get back to y'all.
So I just wanted to look it up here out of curiosity. So it's an FDA approved treatment for mild to moderate acne. And just looking at it, it almost looks like it's a carbon facial peel. And you guys may have seen those videos online, TikTok, social media, where they have like basically like this, it almost looks like ash basically on their face. And the laser goes through and when it zaps, it immediately kind of evaporates that carbon that's on the skin. So it kind of looks similar to those type of treatments. I think there's another device that's like this that goes by a different name, but actually I haven't used either of these. So they say they claim that it can eliminate the need for daily oral medications, topical medications, and combination therapies for acne. And then, of course, with isotretinoin being a serious medicine, there's monitoring and stuff with that. So, and then they claim to see results in 2 to 3 months. Degree of improvement varies. Current data shows average improvement of 65% in 3 months, 74% in 6 months, and 85% in 12 months. So that's kind of interesting. I mean, there's a lot there. Over a year. I mean, I don't know what age they're doing these treatments in people for one, but I think it's always nice to have another option. It's really cool. It almost looks like it has a small, like almost like a cannula, like a little tiny. It almost looks like a little cannula on it, and then there's actually two pieces to it. But that'd be interesting to look into more. But yeah, we don't have that where we've been, and it'd be cool to learn a little bit more about that. Let's see. Let's see. Are chemical sunscreens dangerous for pregnant women? So that's a good question. So as most of you guys know, over the last I don't know, maybe 3 years or 2 or 3 years, there was a big study that came out that showed that chemical sunscreens are absorbed into the skin more than basically that companies had expected. So that was the kind of the surprising findings, which of course leads to say, well, we need to do more exploration and research on this. What it doesn't mean is that those sunscreens are dangerous. So what I tell people if they come at me with this question at all is if you basically want to avoid this controversy or this concern altogether, there are a ton of great mineral-based sunscreen products with zinc oxide and titanium dioxide that basically avoid all the chemical, aspects of sunscreen, and they're not absorbed. So that is a great way to avoid it, and we see that, in basically children that are like under 6 months old or young. They got a really high like body surface area basically, so they can absorb a lot of things. And so we don't go slathering those kids with chemical sunscreens when they're little bitty. But we could use a mineral sunscreen, especially as they're a little bit older. But the best thing for them, of course, is just sun avoidance and sun protection just by shading and things like that. So it's a good question, but these things haven't really been proven to be dangerous, which was kind of the press that came out when all that happened. We are doing this new thing. I do have badges turned on, so if we've helped you at all, if you want to get a badge, feel free to do that. Hope we're answering some good questions for you today. Do you see anything that's popped out to you, Dr. Grove, there that you want to answer?
I think along the same lines, people are asking which sunscreen is the best. I think they're all pretty similar. The most important thing is, though, as Dr. Grady was mentioning, I always recommend the mineral sunscreens. Just as you say, it's easy to get past controversy that way. It gives people a little bit of peace of mind. And then for my younger patients who are kids, that's an important time to protect your skin. That's the time where you form the most moles, and that's the time where you have the most sun damage and your highest risk of skin cancer, even if it's just one burn. So I just recommend across the board mineral sunscreen. So when you go in the sunscreen aisle, what I say is just look at the back of it. Look for sunscreens that say titanium dioxide or zinc oxide. And then I say trial and error. So what that means is if you like the sprays, there's some that have spray mineral-based sunscreens that might be a little bit more expensive, but they've been getting better where they rub in and aren't as heavy. For the ones on the face, I tell patients avoid spray sunscreens. Do the zinc oxide, titanium oxide again, cream-based. ketones, and those same sunscreens are the ones I recommend to my patients.
Yeah. Yeah, I think there's a lot of dermatologists that really like the Elta MD sunscreens. They're a little bit more expensive, but it's certainly worth it for a sunscreen you're going to use every single day, especially for a facial sunscreen. But one of the things, the trial and error thing is important because they are expensive. Sunscreens, I mean, if you go buy a typical La Roche-Posay sunscreen, it maybe is $30, but they're nice, they're elegant, they make a lot of great options. So what I recommend is I love like having people go to Ulta or go to Sephora. And Ulta, I think, has a better selection, but go to Ulta and you can actually try all the samples and you can find what suits your skin best and not spend money. You can find the one that you like or you think you like, and you can buy that. And that may save you a lot of buying things online and getting it and feeling like, oh, it's too greasy for me, it's too heavy for me. So that's something that you could do. And then, so will bleaching skin improve hyperpigmentation or acne scarring? So this is Brown Skin Girl asking the question. So for one, your name is Brown Skin Girl. Basically, hyperpigmentation is the wrinkles for darker skin types. I mean, hyperpigmentation is so common. It's so frustrating because one acne bump is going to leave you with a mark there for months afterwards. It's really frustrating. So does hydroquinone and things like that have a role in treating those things? I think it absolutely does. Along with the other things that we've mentioned over the counter, the kojic acid, very gentle tranexamic acid, even niacinamide can help some. So all of those are important, but the biggest thing, for people that are dealing with acne and dealing with hyperpigmentation, especially with darker skin types, is you have to get the acne under control first, because otherwise it's just a terrible, terrible battle. Now, the good news is the acne treatments like tretinoin or the retinoids that we were talking about, they're actually going to improve hyperpigmentation in their own way. And actually, I only recently learned like tretinoin actually does inhibit tyrosinase too. That was something I found studying for boards, which I was like, okay, I always think of it more of, as Dr. Grove said, like an exfoliant, something that's turning over skin cells, but it actually does have a separate mechanism, and when it inhibits tyrosinase. Now, your hydroquinones and things like that, or the skin bleaching creams you're talking about, is probably going to do that to a much higher level. But it's nice to have that cell turnover effect along with a bleaching cream, and that's why you see some of the prescription treatments are actually going to be combinations of those things. They're going to be combinations of your retinoid and your skin bleaching. So that definitely can help. So we usually use that kind of combo approach on those. Other things that can be helpful are microneedling and cosmetic peels, but you want to have those done by an expert, because again, anytime you're introducing some degree of damage and trauma to the skin, you're also at risk for having hyperpigmentation. So yeah, that's a really, really good question. So someone off topic, someone on YouTube had said that if my name is Swollen D, I need to take my shirt off more often, or it doesn't make any sense. Then someone else said, oh, you're going to make him blush. So either way, we're going to keep it PG. So thanks so much. But that is where the name came from. I have done a few bodybuilding shows in the physique category, and haven't done that in a while. But I've wondered. We've talked a little bit about Swollen D being a bit of and maybe it's not my best name anymore, but I'm in too deep now, so I can't really change it. If you look on YouTube, about literally the highest category outside of people searching for adapalene, the highest category search for people to find my page is searching Swollen D. So if I change the name, nobody's gonna find me. So City says, hey Doc, love your videos from India. Awesome. Thanks so much for joining, City. Appreciate it. Yeah, let me know where you guys are coming from today, because it's awesome to see all the countries that usually showed up. So they're talking about, here's the Sebaceous again, talking about gold nanoparticles into the glands. It heats up the gold to cause shrinkage and decrease function to the glands. So that's pretty cool. So maybe you're using the gold as a chromophore, and that's what the little needle's for. They're putting these right into the areas of acne. It's kind of weird. I mean, kind of weird to me in a little bit, because like acne is like a transient temporary thing, and you're putting these little gold particles in your skin. I don't know. It's interesting. It's good to have another option. I'm always happy to have another option. So let's see what we got. I'm going to scroll down the bottom because some people have probably been waiting. So Blue, this is a really good question about, is it true that some sunscreens cause cancer? Maybe Dr. Grove can take that one.
Yeah, happy to help with that one. So I am not aware of any sunscreens causing cancer. This is something
Right. And I think, I mean, just for, full, to fully kind of explain it too, like, I think there's been some links of like low vitamin D essentially to some internal malignancies and things like that. But that doesn't change this. It doesn't mean that sunscreens cause it. You really can have a normal vitamin D level with just very limited sun exposure. It doesn't take much of your body being exposed to sunlight to make vitamin D. And more importantly than that, you can supplement vitamin D with oral supplements that are safe and do exactly the same thing. You don't need to expose yourself to a true carcinogen, which is the sun, to have a healthy vitamin D level. So if you're worried about that, of course you could have it checked and you could supplement with vitamin D or potentially change your diet to ensure that you're getting vitamin D through those things. The Annika asked another really good question about, I don't know if you've seen Dr. Grove with all the hype about some of the Neutrogena spray sunscreens getting recalled for benzene. Have you seen that?
I have. And you know what? It's one of these things where it's difficult to fully analyze the data because there's so many confounders. I'll be truthful, I haven't delved into the research as much as I should, so I can't comment fully on that.
Yeah. Okay. And Blue follows up with a question: are there still debates going on if benzene is a carcinogen? And so I don't think that that's up for debate. I think if you look at the Food and Drug Administration and things like that, it's pretty well established that benzene can cause cancers, particularly like hematologic malignancies or like blood cancers. But the reality is, benzene is in so many things around us. It now you don't want it to be in your sunscreen, right? But as somehow this was a byproduct of something and it was basically contaminated. I'm not actually sure the levels of the benzene that was in the Neutrogena sunscreen, but I think that they made the right move to recall it because just to be safe, it was clearly not something they were trying to put in the sunscreen or cause problems, and they took a step, which I'm sure was very expensive, to remove it. Do I personally think that whatever minuscule amount of benzene that was in the sunscreen would have caused problems for anybody? I'd really have a hard time believing that. Benzene is in like everything around us. I mean, when you have pollution from cars, when you have there's some like soda and stuff like that that had benzene in it. So a lot of the maybe the foods we consume, the air we breathe is contaminated with benzene. And of course, we want to limit it where we can. And I think they did the right thing. They found it and they corrected the problem. I mean, I think that's really good. It's hard to get things right 100% of the time. And when you identify something and you fix it, that's the right move, and that's awesome. It's a shame it was in there, and it's a shame that it got people worked up and worried. But that's kind of my thoughts on it. Dry skin, what do we do for hydrating? So this is a good question. So dry skin, one of the most common problems. One of my favorite things to use for dry skin is using something like an alpha hydroxy acid moisturizer like Amlactin, or there's another company called Ameliorate. And it's nice because one, those alpha hydroxy acids are going to get in between the skin cells and basically loosen up the dead skin cells and allow those to flake away, so you kind of lose the dry skin appearance first off. And the other thing is they serve as humectants, so they have the ability to hold moisture on the skin. And you can apply these basically right after you get out of the shower, just pat dry, and that's all that's all you got to do. We like that idea of, and Dr. Grove does it all the time, but the soak and seal method with kids and eczema. But basically, you're basically taking your shower or bath, you're washing off with clean water, you're just a little bit damp, and then you go ahead and put your moisturizer on. And that is really awesome, and it's one of the best ways to seal in moisturizer, because the goal of these moisturizers is kind of replenish that skin barrier and minimize what we call transepidermal water loss. So that's the water loss through our skin, and moisturizers do a great job of that. As a matter of fact, in Peds Derm Clinic all the time, we recommend Vaseline, Eucerin, Aquaphor. These type of petrolatum-based occlusives reduce transepidermal water loss by like 99%. So you're really reducing that. And it's so important for kids with eczema and dry skin conditions because they already have a much higher percentage of transepidermal water loss. So that's a great way to do that. And I do want to thank, it looks like PRR fan did buy a badge. So thank you guys so much for your support. Dr. Grove and I get a cup of coffee after this. So anything else stick out to you, Dr. Grove?
No, I think that's a great
Mm-hmm.
But it's the most sensitive way to do that, as Dr. Green was mentioning, is just that seal and lock method.
Mm-hmm. Yeah, and then Moon Telly asked about using sunscreen inside the house if you're staying in all day. So good question. I mean, the thing you'll always hear from a dermatologist is just be aware that sun rays do come through window glass, particularly UVA light. So that's the type of UV ray that definitely does enhance aging. Negatively infect aging. Basically, it causes aging faster. So that's important to do. And with UVA, you're not always going to see like signs of that on your skin if you're exposed to UVA. Things like tanning beds have a ton of UVA in them too. So it doesn't really play a real role in immediate skin reddening, but it does cause more damage because the wavelength is a bit longer and allows it to penetrate deeper into the skin and really mess up collagen and damage cells down deeper. So I do want to say, go ahead, Dan.
What I was saying is, I do encourage sunscreen inside, and the reason I say it is because it's a habit. Any good habit, like brushing your teeth twice a day, it takes routine effort. So if you get into the habit of putting on sunscreen every day, in the morning and throughout the day, you'll use it every day on a sunny day. You won't forget it. So I do encourage people to do it even if they're staying inside, just because it encourages good routine. And then the same thing, I just want to double down. Dr. B was saying, yeah. So if you're going to be in front of the window or you're working in an office, there's a lot of UVA that still comes through that window. It causes a lot of erythema, maybe not delay tanning, but a lot of sun damage. And that same reason is why you see like people who drive all the time have a lot more sun damage on the left side of their face. So it's really important to still wear sunscreen even if you're getting any kind of sun exposure.
That's true. So for the folks that are still here, I do want to say, so I do have a YouTube channel too. It's SwolMD Skincare. You can go over there. I do videos every week, usually between 5 and 10 minutes long. So they're not long, very concise and to the point, but it does allow me to expand on things a little bit more than I can on Instagram or TikTok. I am on TikTok at SwolMD. For if you have questions about particular skincare concerns, I do have a link in my bio to my Amazon store, and you can actually search different skincare products by problem. So if you're looking for hyperpigmentation fixes or you're looking for acne fixes, it's all listed there, and you can purchase through that. I do get a tiny bit of commission from sales through that link, but you can try those things out. And if you guys have questions, I'm always better about answering questions in comments rather than DMs because when I answer them in comments, it allows to help so many people. And my DMs on IG are like totally flooded, and there's no way I can like even catch up ever. So, and then Belle says, I liked your last video because there were some scary comments there. Yeah, right. So Belle, I was talking to Dr. Grove about this. We actually went to the gym and hit arms before this. But I did a video on Accutane, and I knew it was going to be a pretty controversial video because there are a lot of real Accutane haters, naysayers, fearmongers online. And it's not to say that Accutane isn't a serious medicine. It absolutely is. And, we always take it very seriously, and we have a long discussion about it. So much fear mongering online. But I want to do a video because it's a shame for someone to get scared out of doing it when it's the one thing that can potentially cure their acne. And someone asked about that Sebacia earlier, and if I think it's going to be a replacement for Accutane. I don't think it's going to be a replacement for Accutane because Accutane really allows you to treat everywhere. It affects your skin all over, and it helps. I don't know how you're going to use Sebacia, for example, to treat all the acne on your face, chest, and back that's deep and maybe nodulocystic. So it definitely sparked a good discussion. It's hard because, a lot of these people coming with these opinions about Accutane that aren't providers and really don't have the knowledge behind it or the clinical experience of prescribing it. They have cherry picked a lot of data from different things. They don't really understand how it's done. They don't understand how common things actually happen. I mean, maybe Dr. Grove can speak to some of the patients he's treated with Accutane, but a lot of times it's one of these situations where people come back almost tearful because it's changed their life so much in a positive way. And that's what we see like 99% of the time. I'm not saying that people couldn't have bad side effects, but we talk about those things, and that's the whole point. And again, the videos that I did on YouTube, I address the common expected things. I do say it will change your skin permanently. I think most dermatologists would agree with that. Some people are a little bit more dry. But I'd be interested to hear Dr. Grove's thoughts on isotretinoin or Accutane.
Yeah, so always as sensitive on topic. I think one of the most important things is, and you guys have been alluding to this the whole time, whether it be topical medicines or oral medicines, there's always a little risk to clears up their skin significantly, and they come in happier. You no longer have as much social anxiety, and by far, people are way happier than they did the course than they had.
Right. Yeah, and I mean the other, I mean, if to address some of the big things is like, we ask people about depression and we ask people about inflammatory bowel disease and things like that. And I try to do my best to address this in the video. I mean, I hit it head on. But to me, and again, Dr. Grove, I'd be interested to hear your thoughts on it. But to me, is basically like early studies of isotretinoin or Accutane did show a possible, basically association with depression and inflammatory bowel disease with the medicine. Now, none of the studies like have been super well controlled, or it's not like the strongest research that there is then or and now there's better studies that basically look at it and they simply don't really show that association the way they did. Now, I'm not saying that the data is 100% in saying it's safe and it's totally fine. It's something we still talk about for that reason. But basically, that's just us, wanting to give proper informed consent. But the one of the biggest troubles is with like for inflammatory bowel disease, for example. That's when people are getting diagnosed with inflammatory bowel disease. This is when they're getting the treatment. So it's this association that's just there, and it's this like, it's just the fact, the time that they're getting treated with it. So the vast majority of people, I feel like mood is improved. Now we do see people that report a depressed mood, and honestly, like me, some like I don't want to. I never like would not believe somebody, but I wonder sometimes it's tough when we have to counsel people and warn them about that. And there is like a kind of a placebo effect of like knowing that a side effect may happen. And I wonder about that. But the vast majority of people come back and I feel like their mood's improved.
Yeah, I agree. The vast majority of people's mood improves as their skin clears. There's definitely a certain subset of people where their depression or anxiety works on the medicine. A lot of those patients, I would say, and those are a minority, a lot of those patients, it's not to a severe level. It might be their normal amount of anxiety or
Right.
same amount as before. And it's something we talk about. We open up communication, but by far, most patients continue on the therapy and do really well. You're always going to hear about the really bad side effects when it comes to medicines. It's the same reason when you watch commercials and you hear the long litany of side effects, but those by far are not the things we see with medicine.
Yeah, absolutely. And it's hard because like I want to get on there and I want to make sure that the people on YouTube, for example, are really like seeing the truth about things. But also like some of the people that are debating me on the YouTube are like, I forget what the person's name is, but it's like anti-RX. That's literally their name. And I'm just like, okay, you're clearly coming from a bias point. They maybe had a bad experience in their life that kind of got them to this. But I mean, I could sit there and, I'm never going to change their mind, basically, is what I'm saying. So, but it's harmful because I've even seen people say, well, seeing this comment makes me not want to take it. And I'm just like, well, I don't know what to say. It's simply not true. So it's hard to fight those things. So Knotted Sablazi, so you've asked questions about milia treatment, and sorry we didn't see it earlier. The comments have been scrolling a little bit, so we missed that. And we talked a little bit about milia early on the live. So for milia treatment, the biggest thing is, so they're basically a little deeper than the normal clogged like acne spot. So they're hard to remove. So if you feel like you're squeezing it or something like that, and you're just not getting anything out. The thing is they're a little bit deeper. So that's part of it. And I always just tell people, insurance isn't really going to cover it. But if you go and you see your dermatologist, we can do what's called like an extraction. And basically we just do a little nick in the skin. We use a special tool to kind of extract that milia. Now, what could be helpful, if you're just using topical treatments, probably not going to get better. You really do have to have it extracted. But using your things like your retinoid after the fact can help prevent them from coming back. So that's kind of the thing about it. But basically, it's a physical treatment. Usually, it's going to be maybe $50 or $100. You just pay cash and you can leave safe and happy. They're gone. A lot of people, unfortunately, deal with these for years. They've been there for years, bothering them. So that's a way to do that. So Jane says, this is back to the Accutane thing. this is actually a great point. So when people that are like pseudoscientists, the like kind of random internet people that you find in comments like fear mongering, they use a touch of reality and a touch of the truth to try to sell a much bigger fear factor. So, for example, it is used as chemotherapy, but very uncommonly. It's not like a common chemotherapy. The other thing is, I'm sure that all of us have a mental image of chemotherapy. You hear the word chemotherapy and you think, oh my God, vomiting, you lose your hair, it's this, miserable experience, right? Think about people at the end of the life. Oh, am I going to have chemotherapy, or I'm just going to like live out my last days like this, because is it going to be miserable? So for one, Accutane is literally not like that chemotherapy. Most people are not going to have, like, nobody pretty much is going to have those type of like hardcore chemotherapy side effects. The It is used in certain types of brain cancer in little kids, basically. And the other thing that like stems from that is on the comments you saw people talking about like growth plate closure and things like that. We are not prescribing Accutane to 5-year-old kids. That's not what dermatologists do. Kids shouldn't have acne at that point anyway. If they do, they got another problem. So it's much different. So then they're saying, well, isotretinoin, it's causing these kids to have growth plate closure and all this stuff. It's a totally different situation. You're treating cancer, incredibly serious. Okay, it's a rare way to treat cancer to begin with, and you're treating kids in an age range that's totally not the same comparison to what we're treating patients with acne and Accutane. So it's very deceiving arguments, which is super unfortunate. So it's a little bit of truth. So go ahead, Dr. Grove. I don't know if you got something on that.
No, yeah, I would second that too. And it gets really murky too when you get into the oncology sort of things, just because a lot of times too they're doing, as Dr. Greeny mentioned, different age group, different dosing, different vitamin A derivative, entirely meaning acts on different receptors. And then what you're doing is you're kind of making assumptions, and you're kind of pulling side effects from this or applying it to a different context, which is inappropriate. Especially with the brain side effect, no, that's not something I agree about.
So, Dr. Grove, so Annika that's asked a couple of good questions. She's talked to me before about basically what to do to stand out as a pre-med student. She's already interested in derms, been pursuing tons of derm research, but she's not sure what else to pursue, and she wanted your thoughts on that because she's already asked me in the past.
Whether that be doing like volunteer dermatology clinics or working with, or doing like rotating and volunteering, whether it's like a volunteer dermatology clinic. Remember when I was going through the process, I volunteered at a refugee clinic and did some dermatology there. I also did some dermatology education in local schools as part of the grant project. So I think as much as you do, be well-rounded is really important while not neglecting your studies and your other rotations in medical school. Because in general, your grades and board scores are also important, but at the end of the day, it's the whole. So if one thing's not as good or as strong as another, you have a well-rounded application. I think that's the most important thing. And then the last thing I tell people is just get out there, do rotations, talk to a lot of people. In general, be an energetic, eager to learn, and happy face in clinic. And that goes a long distance, and that'll help out a lot in your application process.
Yeah, I think that's definitely the way to do it, and it definitely can't be said enough that you do have to prioritize your normal test, and that's very important because that's one of the things that unfortunately can close the door on you. There's not many derm spots, and it's very competitive, so you just don't want to have any type of mark like that on your record. That's going to make it harder for you. So if you prioritize that, for one, it's going to get you more ready for your boards and step test anyway. So just approach every block very with a lot of energy, and just try to be a nice person, and try to help anywhere you can when you're in the clinical setting, especially when there's not any level of risk. So there's anything you can just take on yourself and do it, and there's no risk to the patient, and it's just a helpful thing. I say most people would accept that with open arms. It gets a little challenging when you're in the clinical setting and you're getting asked a lot, what can I do? How can I help? Because sometimes it can be a little bit more burdensome to the team that way. So I'd say if there's things that you can do and it's not harmful or risky, just do those things to try to help the best you can. So we've been on here a little bit. I certainly appreciate Dr. Grove for hopping on. You can follow him on his new account, so Dandy Derm. So Dandy Derm, if you want to follow him there, he's just getting started, so I'm sure he's going to give some good peds derm information on there. Again, if you're looking for particular fixes, you can click the link in my bio, go to my Amazon store. So if you're looking for acne stuff, if you're looking for hyperpigmentation products that I agree and love, hop on there and you can get those. And then keep an eye on my YouTube, Swollen Bee Skincare. And I do new videos every week, usually 5 to 10 minutes at a time. And I also do a bunch of giveaways over there. So yeah, sorry, Dean, I didn't get to the YouTube chat as much today. I apologize. So, but yeah, feel free to follow me over there. And then Dan, if you want to close it out, if you got anything else, feel free, man.
This was great. Happy to help out. Thanks for inviting me. I hope we helped a few people out along the way.
Yeah. Absolutely, man. No, thanks for hopping on here. We appreciate it. It's great to get your peds derm expertise. So, yeah, we'll have to do it again sometime soon. So thank you guys so much, and we'll hop off and appreciate